Welcome to this IAP Global Webinar, Academies of Science and Medicine, Actions to Advance Urban Health. You're very pleased that you're here to join us on this. We have 3 presentations coming up, but first let me remind you of a couple of things. First, this webinar is being recorded, and the idea is that the recording will be a little bit edited and then presented as a session, as a virtual session at the forthcoming International Conference on Urban Health, which is taking place in Valencia, Spain on the 24th to 27th of October. You will see that the chat is turned off, but please feel free to use the Q&A button and put any questions to any of the speakers there, and we'll pick them up in the last 15-20 minutes of this 1-hour session, and we'll try and answer as many of those questions for you as possible. We do have our 3 speakers with us live for that Q&A session, but we will be presenting, in order to help us stay on time, actual recorded videos from them. And we hope Lochana Gunaratna is with us right now, but has potential connection problems from Sri Lanka, but we hope you're able to stay with us for the full hour. With that, let me first hand over to opening remarks from our IAP co-president, Professor Depei Liu from the Chinese Academy of Engineering. So Nino, if we could start that video, thank you.
First of all, let me welcome everybody. I'm Depei Liu, co-president, along with Richard Kettler of the InterAcademy Partnership. Under the umbrella of IAP, more than 140 national, regional, and global member academies work together to support the vital role of science in seeking evidence-based solutions to the world's most challenging problems. Today, we are going to hear from world-leading experts on a topic that is really close to me, and I am sure to us all: urban development. IAP believes that everyone, including the future generations, has the right to attain their best health potential. This is why we have established an urban health working group under the leadership of Joe Beaufort, and that is why we welcomed the proposal from the National Academy of Sciences, Sri Lanka, to work on an IAP statement on implications for urbanization in low and middle-income countries. I'm pleased to announce that the IAP statement on implications of urbanization in low and middle-income countries has received the endorsements of more than half of our member academies. So it will be officially launched today during the webinar. I would like to thank each of the group of 19 experts who helped develop the statements, and especially the sincere thanks to Professor Lochana Gunaratna from the National Academy of Sciences, Sri Lanka, for chairing this international working group. Thanks also to Joe Beaufort, chair of our Urban Health Working Group, for catalyzing the second report we will hear about today, a review of our Academy's activities in the urban health arena. I would like also to thank the members of the IAP Urban Health Working Group who play a key role in making sure IAP promotes awareness and policies to support health and well-being in urban populations. Today, we will also discuss an education module and sustainable communities that is the fruit of an ongoing collaboration between the Smithsonian Science Education Center and our IAP Science Education Program. Again, I thank the member of the Global Council of our Science Education Program, especially the chair, Wafa Scully. We hope that the three products discussed today will help inform evidence-based decision-making, enabling it to play a key role in shaping our societies. If this to happen, and we are to reach the targets of Sustainable Development Goal number 11 on sustainable cities and communities, then we, members of the global scientific community, must play our part. This is really the central focus of the IAP mission, giving member academies a platform to reach out not only to policymakers but to the society as a whole. Last but not least, I urge academies, other stakeholders, and you all to disseminate these products widely and to follow up on their recommendations. Thank you all for participating in this important event and for reminding us that we must always support access to quality and robust health. Thank you.
So at this point, I think we would go on with the presentation from Sally Fawkes. Let me just say a couple of words about Sally. She's based in Australia. She's an independent health policy consultant, and she's been working with IAP as a consultant to review and develop a report on the individual academies' activities in the field of working health, and she's here to present that report today. Her interests are in public health, foresight, governance, policy making, and future generations' health and well-being. She's an adjunct professor at the La Trobe University in Australia and a director of the public health program. And she has other affiliations as well. I think we'll put the link to her full biography in the chat so that you can see that. But at this point in time, I would say to Nino again, please run Sally Fawkes' presentation. Thank you.
As scientific leaders, what are national academies of science and medicine around the world doing in relation to urban health and its broad determinants? A grand challenge of our time. This was the central question of this timely InterAcademy Partnership project. I'm Sally Fawkes, the lead consultant for this project. I collaborated with Pauline Sanders to seek answers to this question, and we appreciate the opportunity to present our high-level findings today. Before I begin, I'd like to acknowledge the Wurundjeri people, the traditional custodians of the lands on which I am today in Australia. I'd also like to pay my respects to their elders past, present and emerging, and extend that respect to all First Nations peoples who join us today. Our approach had two strands: an extensive desktop review of materials on Academy's websites relevant to the period 2017 to 2021, and interviews with several leaders from academies in each region and from different resource contexts. 92% of the 141 IAP Academies websites were analysed. These were websites that were in scope for this project, that is, they were in English or able to be translated and were technically accessible. 2/3 of accessible websites contained material on urban health. Overall, given the methodological limitations, our data likely represents an underestimation of Academy's activities in the area of urban health. We need to remember, of course, that for 2 of the 5 years of the period we studied, the work of all academies was impacted by the COVID-19 pandemic. To aid our review, we generated a key search terms list by referring to 4 conceptual frameworks, plus search terms from an International Society for Urban Health and WHO project. These terms led us to relevant materials on Academy's websites. Variations on these terms were also considered to help us detect as much relevant material as possible. The key search terms list had 4 domains. Domain 1 covered the different types of urban contexts, from cities to informal settlements. Domain 2 covered the determinants of urban health, such as built environment, transport, the digital environment, and governance. Domain 3 covered terms related to the life course and population groups, and Domain 4 covered health risks and health and wellbeing outcomes. Activities were identified, then classified under 4 categories: publications, events, committees and other organisational arrangements supporting urban health work, and projects and grants. Overall, publications were the most common type of activity, with 4 in 10 publications on urban health-related topics being scholarly in nature, including those of high scientific quality, such as expert consensus reviews, evidence-based position papers, and peer-reviewed journal papers. Events were the next most common type of activity, spanning conferences, symposia, workshops and seminars, and information and education sessions. These ranged from in-person to virtual. There were clear region-to-region differences in both the number and types of activities, but it's worth noting that it was not possible for us to draw any conclusions about the significance or impact of any one activity. With regard to topics, those under Domain 2, broader determinants of urban health, were most commonly represented as the major focus, sometimes with a concern for equity. Those most commonly tackled as a major focus were natural environment, economic development, and built environment. The least commonly tackled topics were health and social care, education, and the digital environment. Some notable regional variations were clearly evident. We want to emphasise that activities commonly focused on intersecting rather than single-issue topics. For example, the implications of climate change for sustainable development and food security in cities, or governance challenges in developing evidence-based policy responses to social inclusion in urban contexts. Turning to partnerships, this typology represents the range of partnership types we found. Academies often partnered with other national academies and universities within their country, in other countries and outside the region, as well as with regional networks of academies in Africa, the Americas, Asia-Pacific and Europe. Other common partnerships were a diverse range of national ministries and departments in national governments, such as those related to climate, science and technology, environment, agriculture, water and others. Local governments or their representative bodies featured in some activities. Non-government and not-for-profit entity partners included InterAcademy Partnership, International Society for Urban Health, International Science Council and the Gates Foundation. Some partnerships with UN agencies and entities were evident, for example, the UN Network for Sustainable Development Solutions. However, World Health Organization didn't feature prominently as a partner. It's likely that an analysis of other materials not on Academy's websites may have revealed more about the nature of partners from the private or business sector and the types of partnerships that Academies had formed with private sector entities, such as public-private partnership models that enabled some of the events. This exercise might be particularly useful in light of the focus of SDG 17. From the full data set, we identified 10 key insights. These related to Academy's missions, how Academies understand health and urban health, the quality of digital platforms for strategic communications, and activity types, topics and partnerships. Partnerships were found to be important for a range of reasons, including resource mobilisation and as mechanisms for translating evidence produced through scientific work. Partnerships with IAP were valued by Academies as an enabler of their work in urban health, and they want IAP's role in urban health to not only continue, but to expand. Some academies were found to have introduced organisational arrangements and invested in capacity so they could more effectively undertake approaches that are essential for urban health work, that is, those that are interdisciplinary, multi-sectoral and systems-based. Finally, strategic opportunities were identified that we think could give national academies a way forward to strengthening their role in leading scientific efforts in urban health. Here are 12 strategic opportunities we formulated based on our data. Fundamentally, academies could more strongly establish health and equity as core concerns of all their activities. Also, while many academies are doing important work in urban health, they could position their organisations more deliberately for a leadership role in this area. Attention to their mission and strategy would be one part of this positioning, alongside capacity building in strategic areas. A longer-term vision will be required, but even in the short to medium term, academies might be able to strengthen their work on urban health quite rapidly by creating connections between basic science activities in urban health and expanding their own membership to strengthen internal capacity for multidisciplinary and interdisciplinary scientific projects. Notably, given that many academies are involved in some way with work related to climate change, we saw significant potential for leaders of academies to leverage members' existing interest in this area so they can build deeper involvement in urban health and its broad determinants. Building partnerships with other academies that have made these links between urban health and climate change could be instructive. Furthermore, some key partnerships could be brought together in urban health-focused research groups to support ongoing collaborations. Turning to their key scientific communications role, a major opportunity exists for academies to optimise use of digital communications by modernising web-based platforms and using cutting-edge tools and methods. Orienting their mission statements and strategic goals to more clearly focus on health was seen as a way to bring a range of diverse research together in service of national and global SDG efforts. Finally, there's an opportunity to multiply connections between academies focused on basic science and engineering and those that emphasise urban health in order to build synergies across their work programs. Connections to academies focused on humanities, arts and social sciences could also be useful given the importance of governance, urban planning and other areas of social science for enhancing urban health. In summing up, we found a considerable body of accomplishments had been made by many national academies in the field of urban health over the last 5 years, and at the same time, there was variability across countries and across regions in the levels and types of engagement and partnerships. Academy leaders affirmed that academies have distinctive roles in contributing to science-led, evidence-based urban health policy development and action through their research and other scientific activities. One can imagine that fulfilling these roles might benefit from a continuous developmental process featuring cycles of organisational development and urban health-related scientific and communications activities. This brings the presentation to a close, and we'd like to thank you for listening and express our appreciation to the leaders who kindly agreed to be interviewed, members of the IAP Urban Health Working Group, who provided really valuable advice along the way, and of course Professor Jo Ivy-Buford, Dr. Peter McGrath and Sabina Karras from IAP.
Well, thank you for that, Sally, and of course for the mention of Jo Buford at the end there. She has been a catalyst for this project. We will move on with the next presentation. It is from Carol O'Donnell. Carol is the director of the Smithsonian Science Education Center, part of the Smithsonian Institution in Washington, D.C. She's a former K-12 teacher and curriculum developer who now sort of leads a major operation, like you might say, at the Smithsonian, developing curricula and modules and so on, really to transforming the learning and teaching of science. We have been working, IAP has been working with Carol O'Donnell as a member of our Global Council for our Science Education Program for the past 6 years, I think it is, producing a series of modules And we're here today to learn a little bit more about this collaboration, and especially one module on sustainable communities. I understand Joe is here, which is great, but let us continue with the presentation from Carol O'Donnell, and then we'll hear from Joe once that is finished. Thank you.
Hi, everyone. My name is Carol O'Donnell, and I'm the director of the Smithsonian Science Education Center. Today, I'm going to share with you how the InterAcademy Partnership and the Smithsonian Science Education Center are educating youth ages 11 to 18 across the globe through the Smithsonian Science for Global Goals project. In particular, I'll discuss this community research guide you see here called Sustainable Communities, which educates youth on urban health. Now, first, just some background on the Smithsonian Science for Global Goals project. It started in January of 2016, a collaboration between the IAP and the Smithsonian, with the goal of educating youth ages 11 to 18 on the underlying science of the Sustainable Development Goals. The goal was to help students take action to address complex global issues. Now, we target all SDGs because of the science that underlies each of them. But we also target 4.7 in particular, which says by 2030, we want to ensure that all students acquire knowledge and skills needed to promote sustainable development. Now, our program overlaps with UNESCO's Education for Sustainable Development action areas, which range from advancing policy, transforming learning environments, building capacity for educators, mobilizing and empowering youth, or accelerating local level actions. We work not just from a logic model perspective where we're impacting individuals, but a theory of change perspective where we want to impact communities, societies, and systems. Now, our theory of change is demonstrated here. We call it the Global Goals Action Progression. And that's this idea that we're not only developing student scientific literacy, but their sustainability mindsets. So how do we do that? We know that students come to us with questions, and they are at the center of all learning. But they also come to us with their own cultural context, their own learning dispositions, their own background knowledge. And so therefore, we need to take students through a progression that we call discover, understand, and act. To discover an issue, we have students basically ask questions of others, survey their communities, engage in perspective taking. To understand the issue, we have them investigating the issue, using their community as their laboratory, engaging in critical reasoning, systemic understanding, and then synthesizing that information in order to act. And of course, those actions are cyclical and lead to new questions, and therefore the progression starts all over again. Ultimately, not only do we want to develop their scientific literacy, but their sustainability mindsets. So what do I mean by that? That means that we're helping to develop 4 different mindsets. The first, empowerment and agency, which basically means the belief that personal action can lead to positive change. The second mindset, open-mindedness and reflection. The idea that understanding different perspectives is important, and we need to understand the context for knowledge. The third mindset, equity and justice, where students need to respect themselves, others, and their environment. And then finally, a global local connection mindset, where students are able to connect what they do locally with what they do globally. Now, to date, we've developed 8 of these modules, and they all go through this discover, understand, and act progression, where youth are examining a complex socio-scientific issue through multiple perspectives. They're carrying out local investigations on a global problem using their communities as their laboratory. And they are addressing the issue by taking local action in their communities. Now, we are, helping to develop students' global perspectives by creating these learning experiences that are locally relevant and locally driven, but globally important. And we do that by combining science, technology, engineering, and math, or STEM education, with social emotional learning and civic engagement. To date, we've reached 2.4 million students, 30,000 educators across 72 countries. Now, a specific example from this project related to this conference is sustainable communities. How can we help our communities thrive? This guide covers topics such as urban planning, housing, transportation, resource use, and waste, as young people explore the underlying science of these issues and how to make their communities more sustainable. It's made up of 7 parts, and each part addresses a different component of the guide. Now, some of the examples of activities, students might develop an identity map in which they're understanding who they are and their position within the world. That identity map might be 2-dimensional, like the one you see on the right, or it might be 3-dimensional, made up of objects that are important to the student. The students also read about the identity of scientists. For example, on the left, you see that these students are getting to know their research mentor. They also are asking questions to understand their community better, and they're engaging in community research in order to develop that local connection. So for example, they might ask themselves, who lives in my community? How's my community changed over time, for good or for bad? And who makes community decisions, and how can we be inclusive in our actions? Students also might investigate an issue. For example, here, they're investigating existing public and private spaces within their community, as well as commercial areas and green spaces, in order to better understand the balance between human needs and needs of the environment. And then finally, students are acting. These actions listed here came from a France-US virtual exchange program in which students were studying this Sustainable Communities Guide, and their actions included things like increasing native plants around their school, managing green spaces in their community, building pollinators on top of bus stops, reducing plastic packaging, and preserving forest trails. When we asked the students the question, and there were 850 of these students, what are some things that you're proud of in your community? These are some of the photographs they shared with us. When we asked them that same question, but asking, what are some things that could be better in your community? These are the images that they shared with us. Now, one of our colleagues who's in South America, XSTEM, they implemented the sustainable communities in their region as well. And they administered a pre-post assessment. And this is the percentage of positive change that they saw in their students, where students were demonstrating that the biggest change was their relationship to their peers, their perseverance, their relationship with adults. That's all part of social emotional learning. But they were also very much demonstrating engagement with STEM, not just understanding STEM, but engaging with it, thinking critically, enjoying science, technology, engineering, and math, and developing interests and careers. In closing, the InterAcademy Partnership and the Smithsonian Science Education Center are operationalizing sustainable development on a local level through educating youth to achieve the SDGs. The Smithsonian Science for Global Goals project is educating youth on these topics by promoting discovery, understanding, and action. These sample activities I shared with you demonstrate how community research guides, like the Sustainable Communities, are building youth scientific literacy as well as their sustainability mindsets. And that Sustainable Communities Guide is focusing on promoting young people's understanding and action as it relates to urbanization and urban health. And we hope that the case studies I shared with you, although brief, because there are many, demonstrate how students are using their local community to drive action and to promote urban health. If you have any questions or want to be a part of this project as a scientist or someone who has a medical background, please do not hesitate to reach out to me. We are always looking for people in their field to share their work with young people. Thank you.
Okay, thank you very much, Carol. As I mentioned, just as that video was starting, our chair for this webinar has arrived. She apologizes for the delay. Joe Buford is here with us. Joe is has also a long pedigree. She was, amongst other things, the Foreign Secretary for the US National Academy of Medicine, at which time she was the co-chair of IAMP, the forerunner of IAP Health. She has been president 2017 to 19 of the International Society for Urban Health and still plays a leading role in the activities, including the International Conference on Urban Health that I mentioned earlier. And of course, Jo is the glue and the catalyst, the glue that holds together and the catalyst that inspires the IAP Urban Health Working Group. And Jo, I think you were going to introduce some of the work of that group. It would have been ideal earlier before the first two talks, but let's have it now before the third and final talk. So I think Sabina or Nina will be showing your slides, so you have those up, and I leave the floor to you.
Thank you very much, Peter. And again, my apologies. I was expecting to start at 8 a.m. New York time, not 7 a.m. So Peter's correct. It would have probably been better because this presentation is really designed to contextualize at least the work of the Urban Health Working Group and certainly Dr. Fox's work. But now that you've heard these terrific presentations, it should be maybe perhaps it'll make even more sense to you. So I wanted to really talk about the role of academies of science and medicine in urban health, and Sally's work really helps us chart a way forward, but a little bit of context for the urban activities that have been going on at the academies at IAP Health for the last several years. If I could have the next slide. First, in talking about urban health, one of the things we found that's really important is to make it clear that when you say the word health, you're talking about health and not health care. And from a global health perspective, urbanization, along with shifts from acute care, acute diseases, infectious diseases to chronic diseases, epidemiology shift, which has been disappeared a bit by COVID, demographic shifts and the positive results of longer lifespans for everyone on the planet, and then climate change. These are the big four challenges really for the 21st century to human health. Why did this become a global problem in the Sustainable Development Goals? Next slide. This slide really shows how the rate of urbanization is growing dramatically in less developed countries. I think previously, before the Sustainable Development Goals, it was thought that urbanization was an issue of the global north. And it's clear that that is no longer the case. And this was adopted as one of the goals in the SDGs. When we think about cities and achieving health in cities, next slide, we've really tried to contextualize it as looking at the multiple sectors that are involved in creating the environment of cities, the health sector being one in the red dot, but all of the others here, decisions are really made every day in each of these sectors that can be health promoting or undermine health. For example, we now know that urban planning dealing with density vertically can be really important in terms of service availability, but green space and ability to exercise is really important for physical and mental health. In transportation, decisions that essentially minimize the role of cars as a vehicle for transportation in cities has impact on air quality, on safety, and on special populations like older persons and younger people relative to ability to cross streets safely, to bike, to have active transportation. And then what really holds it all together is governance. And this is why in the work on urban development, we're so focused on getting the leadership of mayors, political leadership and support from national level to local government, and to involve communities in the planning of interventions around cities and in their implementation and evaluation. So our Urban Health Working Group really accepted this framing for our work. So our work has been much beyond that of only focusing on healthcare, and you'll see that in the activities we've taken on, and hopefully you were able to see that in Sally's report. And if you take the next slide, we also think there's an argument, as Sally would have made, for academies to be active in the area of urban health, because it's really quite a window into activities in all of the Sustainable Development Goals. And in many countries, national academies are very involved in that country's response to the Sustainable Development Goals action planning. We hope they are increasingly involved in the work on SDG 11, which is the urban goal. Many are obviously involved in SDG 3, which is a health goal. But urban health can really bring academies into all of these important activities. So where did we begin? Next slide. This is our urban health working group. These were launched in May of 2016. Our members were nominated by their academies and have been very loyal and active participants since 2016. Our next slide shows you the rest of this group. And as we really began this group, it was the culmination of some work that had begun a year or so earlier with the IAP Health. Next slide. The Urban Health Working Group, as I say, was launched in 2018. We had really begun talking about urban health about 2 years previously. And that group, as I mentioned, really adopted the social determinants of health approach to explore how academies can advance research and education and practice. The group began to meet virtually over beginning in 2018. And we really used this Urban Health Working Group as a resource for speakers in urban health sessions at the World Health Summit, at regional meetings of the World Health Summit in Portugal, Iran. And this session being taped now will be shown in conjunction with the International Conference on Urban Health to be held in Valencia, Spain at the end of this month. Individual members of our group were speakers at the Consortium of Universities in Global Health and also the U.S. National Academies Forum on Public-Private Partnerships for Global Health in the Urban Context, which was a special session focusing on cities. The group has also served as reviewers and advisors on various projects for the IAP Health. And of course, you'll hear shortly about the statement on urbanization in low and middle income countries from Dr. Gunaratna of Sri Lanka, also a longtime member of the Urban Health Working Group. And you've heard from Dr. Fox. Hopefully we'll get into further discussion of her presentation, which was really a report commissioned and supported by IAP Health, thanks to the work of the Urban Health Working Group. And they've all served as reviewers and consultants and advisors on that report. And the final slide, so where do we hope to go from here after these activities? One is to really promote the understanding across the InterAcademy Partnership that urbanization and health can really be relevant to academies, even those that don't have a specific focus on health, because with our broader definition, we really are talking about projects that fall under the rubric of transportation, urban planning, housing, engineering, climate science, etc., and all of which can be enormous influences on human health. The second point is to really take as a baseline the work in Dr. Fox's report and encourage ways in which academies can become even more involved in their health work and their urban health work in their own countries, especially regarding the Sustainable Development Goals and work in their country on the new urban agenda. And finally, we'd like IAP as an organization wide to really take this on as one of their priority areas going forward, both with activities with the United Nations and with the Sustainable Development Goals. So with that, I'll end, Peter. Thank you. And again, apologize for bringing up the end here, but I think in some ways, maybe it's a revisit for the context for the reports that you've heard. So thank you.
Okay, thank you, Joe. And it's, like I say, always good to have you with us. So let us continue. now we're actually going to, prior to Professor Gunaratne's presentation, we're using this webinar to launch the statement that Joe just mentioned on urbanization in low and middle income countries. And I just wanted to say a couple of words on what is an IAP statement. This is one of a number. I think we've done about 30 over the years since IAP was established. And statements are essentially quite short and hopefully strong documents that have the support of more than half of our member academies, so they're not released until they're endorsed by the majority of our member academies. They are produced by a working group of experts, experts nominated by our member academies, under the leadership of usually the academy or the individual who is a fellow of a particular academy that has proposed the topic that the IAP leadership has accepted to take on. So in this case, we had the Sri Lankan National Academy of Sciences propose the topic on urbanization in low and middle income countries. And it was the development of the statement was led by Lochana Gunaratne. And we're very pleased, as I said, to announce that the statement is being released today. Here it is. I hope you can see it against the background. It's online. The link has just been put in the chat. So it's there for your academies to take a look at, hopefully add to each academy's website. There is a press release being presented as well with some quotations, and it's like a news article. So we hope this will aid the dissemination. So at this point, let me introduce Professor Lochana Gunaratne. As I mentioned, he's from Sri Lanka. He is former president of the National Academy of Science of Sri Lanka. He was trained as an architect in London, received a master's in city planning from Harvard University, and then did his PhD at the University of Colombo in Sri Lanka. He has led many professional associations in his country, including the National Academy of Sciences, the Sri Lanka Association for the Advancement of Science, and the Institute of Town Planners of Sri Lanka, just to mention a few. And not surprisingly, his research focuses on issues related to urbanization in Sri Lanka and the broader South Asia area. And we're very grateful to him to have led the process of developing this IAP statement. So let us hear now the presentation of Professor Lochana Gunaratne. Thank you.
These are 17 experts from all around the world who have helped me greatly. I'm very thankful to them. Urban development in low and middle income countries, LMICs, has been the subject of serious recent discussions at the international level. In 2015, UN member states adopted 17 Sustainable Development Goals, SDGs, among which SDG 11 was about the sustainability of cities. In 2016, a new urban agenda was endorsed by the UN General Assembly. Those two events bind all countries to promote those recommendations. The word urbanization here relates to rural-urban migrations and the growth of urban populations relative to that of rural populations in any particular country. Urbanization was associated with industrialization in the 19th century Europe and often resulted in economic growth in those countries. Thus, in the popular understanding of urbanization in the LMICs, economic growth has become associated with urbanization. However, the economic conditions that spurred urbanization in the Western world are not the same as those causing urbanization in most LMICs today. The urbanization process in the LMICs. Framing relevant policies for LMICs require a clear understanding of the urbanization process currently being experienced. Today, urbanization occurs almost exclusively in the LMIC. It can bring about positive dividends, especially for women, and longer lifespans for all. But these dividends are not guaranteed. When the process is mismanaged, as often happens, it results in serious inequity, social unrest, and the rapid growth of informal settlements. Thus, urbanization policies, urban planning, and management are deemed to be very necessary. A reliable prediction is that by 2035, all the fastest growing cities worldwide will be in the LMICs. A relevant statistical study concludes that urbanization induces growth of the largest cities, occurs often without industrialization, is consequent to demographic explosion and poverty-induced rural-urban migration, encourages the growth of informal settlements, and occurs more because of rural push than urban pull. This interminable distress migration, directed often towards major cities, results in the diminishing the quality of life for all urban residents in those cities. Today, urban population increases happen in overcrowded and underserved informal settlements. Informal settlements is a polite word for slums. These urban residents are part of an informal city which functions independently from and in parallel with the formal city. Cities in many LMICs have some surprisingly common characteristics, which are unequal access to all infrastructure services and to decent housing, strong residential segregation, the existence of informal and often illegal systems of land occupation for housing, inadequate land use management, and the inability of most urban local authorities to deal with these complex issues. Also, some LMICs that have other causative factors include intense national population growth, very high urban population densities, unsatisfactory housing units with very poor sanitary facilities, authoritarian political processes, and inadequate social participation in planning decisions. Large primate cities and limited autonomy and resources within urban local authorities, and also poor vertical coordination on relevant national policies. Now, planning approaches and theories. The application of exogenous development models is discouraged by knowledgeable planners and scholars in almost all LMICs. An important recent study on the current trends of horizontal urban expansion through urbanization predicts the tripling of urban land cover worldwide within the next 3 decades and the consequent adverse impact upon biodiversity. It also states that the main biodiversity hotspots being affected are in the LMICs. LMICs need to preserve their agricultural land and habitats through compact, sustainable urban development. Furthermore, the evidence is that more compact cities are correlated with lower greenhouse gas emissions and higher productivity. Intervention at the national policy level is invariably needed. An important recent observation by the IAP itself is that the potential for science to ameliorate or solve the problems of the world's multiplying cities has not been realized, end quote. A review of spatial planning literature reveals much scholarship that could influence urban policy interventions. Science and technology can and should inform decision making. Another very important focus is on the role of small and mid-sized towns in the development of LMICs. A well-known British researcher concludes that colonial policies reinforced by post-colonial economic growth strategies of the 1950s and 1960s were major causes of the rapid growth of some cities in many LMICs. Urban development was generally prioritized over rural development. Emphasis was on modernizing the metropolitan economy, while rural regions were often neglected and left impoverished. More than 100 reviews of empirical studies across the LMICs and a large number of national programs for small and mid-sized towns demonstrate that spatial planning programs can be crucial in attaining social and economic objectives, increasing and diversifying agricultural production, and increasing the influence of citizens living in subnational and subregional political and administrative units. Now to move on to policy concerns, a UN publication on Asia, 1979, states that urban-rural inequality is a major problem and that more attention should be paid to rural development. These inequalities are also found in most LMICs and other continents. Even where small towns with some infrastructure facilities exist, inadequate urban governance and poor management prevent the much-needed extension of those services to their rural hinterlands. Investments should be made in infrastructure for mid-sized cities to improve mobility by public transport and for accessibility to services. The investments necessary for tackling the challenges in cities in many LMICs require the engagement of their national government. Vulnerable human habitats due to the adversities of climate change include low-lying coastal towns and conurbations exposed to sea level rise, landslide-prone areas in hilly terrains, and low-lying urban areas that are exposed to frequent floods and also heat waves. In these circumstances, the resettlement of vulnerable populations in safer locations may be the best option. Now, even assuming a committed approach to rural development, out-migration from rural areas for non-farm occupations is likely to continue. Rather than have these rural migrants target the larger cities, the more manageable scenario is a gradual process whereby rural migrants move first to the mid-sized towns. Then, movement to large cities may be confined to the more urbanized migrants from the mid-sized towns. Public health should also be of special concern in urban planning. The need is to counter the easy spread of epidemics in dense human settlements accentuated by urbanization. Lower-income urban dwellers consequently face the twin burden of communicable and non-communicable diseases. Also, there should be space for social participation and democratic governance on decisions to be made by urban local authorities. Finally, urban planning under all these initiatives must also be guided by the UN's new urban agenda and also the Sustainable Development Goal number 11. Thank you.